The social challenges for any child who has suffered a traumatic brain injury vary based upon the type of injury, obviously, and what their limitations are. Um, I have one case that is coming to my mind where um, the the children are close and the siblings are close in age, and she sees her one daughter progressing so much faster and doing those normal things, and her other daughter just isn't going to do that, and trying to find ways to balance that, because as you're little and you're injured, you can be picked up, you can be carried around, you can maneuver easily, and as you get older and you still remain in that same mental state but have all of the attributes of an adult, it often becomes much more challenging. And I find people find that children who are injured, that they sort of come to, right? You want to cuddle, you want to feel, you want to be close to, and as you get older, you may not feel that same willingness to reach out in the same way. And I think that that's really, really difficult, because then you're different, and how you help society interact with that is really an important thing to understand and cope with it as a parent. Somebody was telling me last night that they were out with their 4-year-old for Father's Day, and somebody came through in a wheelchair, and of course he's 4, so he says, "Look at that guy in the wheelchair," and she was absolutely, she immediately reaction, but that is normal in the real world when you're not in the safe hospital environment, and giving people tools to be able to cope with being different is part of the process and part of the psychological services that go along, not just for the child, but also even more so for the family and siblings. We often see this in children with autism who may have outbursts or behaviors or have no speech, is trying to help people cope with how people react to that. It's tough. It's part of, again, all that social support that's with you during the beginning of the injury isn't there in that same way when your child is sitting in the back of the church screaming, and you're feeling uncomfortable, and how you help people manage that and create that warm environment is really, really important. And it's as important for us to make sure that the community access is there. Not just the physical, is there a ramp, does the door open, but the emotional, is there a safe place for them to be in a library if they can't contain their voices, or they do act out in a different way, and making sure that they can still participate is as important part of the process as the therapeutic interventions.